I mentioned, my name's Alva Cashman, Poverty Proof and Coordinator with Children North East. A little bit about us, if you haven't heard about us, which you may not because you're down in London. So we are a charity based in Newcastle city centre. We've been going since 1891, so one of the longest running regional charities in the UK. And the charity was originally developed to bring children who lived in kind of like the tenements of Newcastle out to the beach for the day. And that still goes on. We still bring children from the local communities out to the beach once, sorry, once the weather's a bit decent. Living in the UK, we have to take it when we can get it. So obviously in the 130 years since then, we've really diversified. And one of the massive things that we look at is poverty proofing, which I'll explain a little bit about before we get into kind of the toolkit, just to provide a little bit of context about kind of where this came from, and a bit of context about kind of why it is the way it is, I suppose. So today, yeah, we're just going to look at what poverty proofing is all about, how it informed the guide, and we're going to look at how you would learn to kind of use the guide in your own practice going forward. I do kind of like hope that it's very practical, it's straightforward, and it's there to kind of more give you guys ideas, like a kind of a bit of a jumping off point. But before we get into that, I will just give you a really brief introduction of what poverty proofing is. As I said, bit of context. So about 10 years ago, at Children North East, they ran a project where essentially what they said was they gave a load of children in the local area, because where our office is based is actually in an area of quite historically high deprivation. So they gave the children some disposable cameras. So that'll tell you how long ago it was. And they basically said, go out into the community, like in your day-to-day life, where do you feel most poor? And take a picture of that. And absolutely heartbreakingly, most of the photos that came back were of school. So things like having to stand in different queues if you got free school meals, if you were going on a trip and you had to get a lunch off the school, it was given in a brown paper bag, so everybody knew, things like that. So what we did then was we developed poverty proofing as a methodology to poverty proof the school day. So that still goes on to this day. But since then, we've also branched out into, we've got poverty proof and arts, culture and early years. So things like museums, National Trust sites, stuff like that. Because we do think like arts and culture should be accessible for everybody. And then we've also got poverty proof and health, which is why we're here today. So what exactly kind of is poverty proof? And this is the ethos that it's based around, and this is something that we take very, very seriously. So it's no activity or planned activity should identify, exclude, treat differently, or make assumptions about those babies, children, young people and families whose household income or resources are lower than others. And this is something you will hopefully see this in the guide. It's very, very important that we do not make assumptions about people. We need to engage with people. We need to talk to people. We can't just make assumptions. So with that ethos, we've got kind of three principles that, pardon me, or three pillars that kind of underpin the poverty proofing methodology. I'll go through these quite briefly again. So first and foremost, we've got people. We make people's voice at the heart of everything that we do. So what we'll do is, and I'll explain in a moment when you see what it is we physically do, but we gather voice. And we see kind of a lot of times in many, many settings, with the best will in the world, somebody at the very, very top of that setting will make a policy that's designed to be inclusive for everyone. But unfortunately, the kind of life experience of that person at the top is so far removed from people who have the least that are trying to access the services that, sometimes these policies don't always work in real life. So what we do is we gather the voice about what it is people actually need. Second, kind of principle that we have is place. So we recognize that place is very contextual. For an example, if we give certain recommendations, you know, we have to give general recommendations unless we know the setting, unless we've been in the setting, because, for example, things that may work in, like a maternity ward in Newcastle better, Newcastle city centre, is not going to be something that might work in a very rural GP surgery. So that's where that place, it really, really comes into play. And then the third principle, which is the best principle, this is that it's structural inequalities or systemic. And so this really means that most academic research tells us that poverty is actually due to structural or systemic inequalities, which is really brilliant news. Poverty is not a force of nature. Poverty is something that we as a society have control over. We've put these things in place. We can change them. And, kind of if you are part of like the NHS, which is arguably the biggest system kind of UK wide, you're in a really privileged position. You're able to be part of that change. And I think that's absolutely fantastic. So I've kind of talked about a little bit around the background. So this is just physically what we've done. And now this is what we do in settings where we do a full poverty proofing intervention. So this is work that has informed the guide. As we haven't kind of gone in to do these things in East London, but this is the stuff that we have done, and I'll show you guys in a minute the range of settings, so you can see, these things aren't just plucked out of thin air. This is informed by many reports, many kind of interventions that we've done. So when we do that intervention, we do training and initial staff consultations. So we'll do a 3-hour training. And that's like a really kind of like intense poverty awareness training, some practical bits in there as well. And what we also look at is speaking to the staff. Obviously, as you guys are aware, staff in settings, you will be the ones that will see how poverty is playing out with your patients and your service users and their like families and carers. We've also got then scoping, which kind of just us being a bit nosy. Essentially what we do is we go into services, we do in-depth conversations with staff. We try to speak to as like people from every different kind of department. And we look at things like what's the transport infrastructure like, things like that. We then do so we've got patient and community consultations, and this is what I was talking about when I talk about people and gathering voice. So when we do these interventions, we go in and we speak to as many patients, service users, carers as possible to kind of get as close to that lived experience of accessing the service. And then community, we look into the wider community and speak to people there doing the exact same thing. And then so those kind of quotes, those experiences, that forms the bulk of the report that we kind of give to settings. And for each barrier that we kind of find, we make a direct recommendation on how we would approach fixing it or alleviating it, sorry, just from, again, empirical evidence and also from kind of our own experiences. And then we come back in about 6 months, 12 months, and do a review, which is kind of just to see what's gone on, what's changed, what the impact is. So this is just the kind of range of settings that we've done. And you can see, kind of there's loads and loads of different places there. And this is all that kind of work that we've done in these places. This is all informs the guide that we're going to go through today. If anyone has any questions about any of this, again, like the range of settings and in particular when asked, just let me know at the end. So we're going to have a look at the actual guide itself. Now, what we've done, just for the purposes of this presentation, is we've kind of just condensed it a little bit, kind of just for the purposes of the slides. But if you do have a copy of the guide there, please feel free to follow through that way. And again, if there's anything that you would like me to clarify or anything like that at all, just let me know at the end. Thanks a million. So yeah, this guide was developed a few months ago. We kind of did like a bit of a webinar, I suppose, about kind of poverty awareness and things like that, and it led to this guide. So this guide really, as I said, it's been informed by all our work, and it was really based around kind of addressing, like, people not being able to attend their appointments, and like, kind of what we can do on a practical level to mitigate that a bit. So we've just got a little bit at the start, just about Children North East. Obviously a long history, 130 odd years. Obviously I was not there at the start. But this is kind of shows we've got really, really rich history in this area. It explains poverty proofing, gives just a couple of those statistics. So yeah, unfortunately, at the moment, there are over 14.4 million people in the UK living below the poverty line. A bit of context, that's about 1 in 5 people. And there's also been additional research conducted by the Joseph Rowntree Foundation, which essentially says that there's an additional 3.2 million that are £40 a week away from that line. So we've got about a quarter of the population that are experiencing severe financial hardship. And we know there's 4.2 million children that are living in financial hardship. So these are kind of the three, as I said, they're the three principles or the pillars, and we've gone through them. If you want me to clarify anything at the end, absolutely, but they kind of, in the guide, it goes a little bit more in depth into them, just so you kind of know where we're coming from. So this is kind of what I want to talk about, because I think this is the most important bit of this guide. So what we did was, we understand that we can't go and poverty proof absolutely everywhere. We don't have the capacity. There's 5 of us, and this is a very big country. So what we've said is we came up with this framework, and this is something we give this to places that we have poverty proofed. So even if you have been poverty proofed, it's not just like a tick box thing and it's done. This is something that takes ongoing work, and it needs to be done again and again and again. And what we also do is we discuss this framework for places that we haven't poverty proofed, just to kind of start that work. So that's ask, listen, act and advocate. So ask, this is the most important thing. What we tend to do, and when I was talking about the ethos as well, you can see this, people make assumptions, we make assumptions. It's human nature. But actually we need to start asking people, asking those service users, asking those carers, because they will tell you, they want to tell you. In all of the settings that we've done, when we did our consultations, what happened was, one of the big questions we always asked is, would you feel comfortable discussing this with the setting? And people always say, I would, but no one's ever asked me. People want to be asked. And I know it can be a bit scary at the start, but please, we need to start asking people. And as it says there, routinely and universally, kind of every time somebody joins the service, ask everybody. Keep kind of up to date with these things, keep on asking people, because obviously circumstances change. Then we look at, obviously, listen, logical next step. But what I would just say, kind of when we listen, we need to obviously listen completely non-judgmentally, don't make assumptions, but also if we are aware that, kind of people who may be experiencing hardship, may not have the energy or kind of, the extra capacity to really be able to advocate for themselves. So what we need to do is we need to really listen to what people are trying to say, ask clarifying questions, pull that thread, follow up, and then, act. Easier said than done. But what we see a lot of is, people saying, well, there's no money, we can't really do anything. But actually, you're kind of looking at, like, I've had a comb back through some of our other reports, ones that I haven't written, and in basically all of them, about 90% of the things that can be done don't involve money. They're things like policy changes, they're things like, making active phone calls instead of just sending letters, just small things like that that can make such a difference. But there are in some cases things that are out of our gift. So that's what we want to do. Sorry, that's when we want to start advocating. So that would be kind of gathering data. Is this a problem that presents trust-wide or setting-wide? And then kind of have a look about then moving up the next level, going to trust level, going to, the next kind of level up, and saying, actually, we have found that people need X, Y, and Z. What can we do to actually facilitate this? And I know sometimes things like this, they seem very, very simple, but actually, it's these small things that make a massive difference. So when it comes to kind of, especially people being unable to attend appointments, we've kind of had a look. These are some of the barriers that we've found that are the biggest across every single setting. So we've got, first and foremost, we've got travel. And, this is kind of, as I said, quite simplified for this presentation, but on the guide, we've got a lot more questions there. And it's really, these are things just kind of like to give you a little bit of guidance about, like, what should I be asking? What way do I need to think about this? We've got kind of that, like, ask, we've got listen, so kind of gives us a little bit of a guide on what we're listening to, what kind of follow-ups we need to make, some little ideas about how to ask, what can we actually do that's just small and can be done quickly and easily. And then we've got things that advocate. So that is kind of like, that's when we start to almost look outside the setting and see, kind of, we've got things like local operators providing travel passes and looking at trust-wide things. So travel, no matter where we go, it's always a massive one. I'd say especially kind of like Northeast, but London is going to obviously have its own travel barriers. It's not just the cost of travel, it's also, the fact that maybe driving might take 20 minutes, but public transport's going to take 2 hours. And then, being given appointments at times where people might need to get children to work, or children to school, while also getting into their appointments. So that's something to kind of think about. We've also got communication. So communication is always an absolutely, like, massive issue. And it's kind of, is the service easy to get in touch with, essentially? Are people kind of sure about, when their appointments are? What we tend to see a lot as well is issues around not just digital literacy, but kind of literacy in general. In the UK, the average reading age is age 11. And that can be kind of much lower in certain areas of deprivation. Are the materials, first of all, in a language that people can understand, but also are they kind of pitched at the right level? And we do have a resource for you to use when to check this. It's called the Flesch Kincaid. Hope I pronounced it right. The Flesch Kincaid calculator. Essentially, what you can do is you can copy a bit of text, pop it in this calculator, and it'll tell you what reading age it's pitched at. So it can make things, kind of make it easier for people to understand. And yeah, just little things as well, like, just marking kind of this person doesn't like phone calls, this person prefers texts, things like that that are quick and easy. And then we've also got things, you know, outside the trust. We've then got patient empowerment. So this is, you know, kind of making sure that people feel like they're being heard, that they have a voice. What we see a lot is that you know, patient participation groups are fantastic, but what we see is a lot of people who make it to those groups are the people that are going to make it to appointments as well. So while their voices are obviously very important, we're not gathering the voice that is actually those people that aren't making appointments. So what can we do there? I know for myself, for patient or community consultations before, I've literally spent a day knocking on doors. So, you know, kind of, obviously, I'm not suggesting everyone go out and knock on doors, but it's things like that. How can we be proactive within communities? And can we make sure that people understand the information that they're being given so that they feel like an active participant in their own healthcare? We've then got staff awareness and guidance, and I think this is something that's very important. It's, as you are all absolutely aware, you know, poverty has a massive impact on healthcare. And I think kind of, you know, the more we see a lot now is that we're realizing that healthcare is not just a clinical thing, it's a holistic thing. And we need to be able to kind of be aware of, you know, kind of what's in the area. So kind of if a patient or service user or their carer mentions that, you know, they're not eating correctly, do you know where the nearest food bank is? Do we know how to kind of get people there? Do people know what benefits they're aware of or that they're able to get, they're eligible for? We've got some resources there. And you know, kind of, as I mentioned at the start, using that financial assessment tool to create and update a financial snapshot. Again, we've got a really, really good resource for that. It's WAM, which has been developed by paediatricians. And as far as I'm aware, there's been a setting that's actually in Elft that's been involved in that as well, which is quite interesting. So we've got that as a resource as well. We've then got navigating the systems. That's really kind of like booking appointments and making sure people know what times there are appointments at. Are people being given appointments at a time that they can physically make? And kind of, you know, possibly providing food for people who may have long waits. And then we've got patient empowerment, which has come up already. Sorry, that was me hitting the wrong button. So that's the kind of toolkit. You know, again, like I'm really, really open to any in-depth questions. But it's more just if you understand the framework, then you can just use that guide, take it and run with it. And then, yep, this is a bit of a shameless plug at the end. But this is kind of like, if you want to work with Children North East, here's what we offer. We do online or face-to-face 1 hour poverty awareness training. We also do webinars like talking about poverty, stigma and unconscious bias, maternity, things like that. We do half-day workshops, again, face-to-face or online, on how to start identifying and addressing barriers in your own service. We do full poverty-proof interventions, just kind of the process I described at the start. And we also do a delivery partner model. So at the moment, we are working with 2 separate trusts to help them poverty-proof their entire trust. So I think one of them is like 150 settings, which, yeah, that's going to be fun. But it's really, really good. And there's loads of stuff we do there. So I'm aware I kind of ran through things a bit quickly, but you know, please feel free to ask questions. My email is up there as well if you have any questions for myself. And yeah, thank you so much for listening to me for half an hour. Thank you.